Well, everybody, I have a special guest today. I have Chelsie Ward, and she runs my Detox, not Retox program here. Chelsie is an exceptionally well-trained practitioner. She also is our client, having had an explant, and is a great person. So thanks for coming on the show, Chelsie. And today we're going to debunk or explain retox versus detox and what we should be doing on a day-to-day basis, whether we have implants or not.
Thank you so much for having me. It's great to be here.
So we were joking offline. What should we be talking about today? And obviously, we have tons to talk about with chronic inflammation, acute inflammation, detoxification, your liver, your kidneys, your food, your air, your fluid, da 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 da. And then we have a near or dear colleague who retoxes a little bit with his grape juice at night. And I'm sure a lot of you retox with your grape juice at night, if you understand what I mean. Maybe Chelsie will elaborate.
The lovely grape juice, the adult version, of course, that's really important. If you're drinking grape juice at night, just make sure it's the adult version. Or maybe we should go back to the kid version so that we don't retox ourselves.
Well, we can start there. I mean, obviously, I have a really funny story. So I went to med school in Reno, Nevada. And at one point, I was like, I have to go. I'm really close to Napa Valley, take a trip, go there. And went to the Mondavi winery. And it was before it was sold. And I didn't have a lot of money. I'm not just a student in school, and went to the little wine tasting thing. And they said, hey, this bottle we feel is going to be a very good bottle. Lord knows how many times they've said that to somebody, but they seemed pretty convinced that this year in particular was very good. I'm an idiot. They probably all say this everywhere at a winery, thinking like some dumbass like me will show up and buy that wine. So I get the bottle, and it ends up being, it's 1994. Anyway, one of those 2 years became an extremely good year in wine. In particular, it was a Cabernet that they had. And I gave it to a mentor of mine as a gift because I was finishing school. And she was pretty astute with wine and used it as part of a packing party to move herself, not knowing that that bottle would eventually be actually one of the better bottles they ever made. So back then, there were multiple producers of wine in the United States. We're talking like 1990s. And now some reports say there's only 8 manufacturers of wine in the United States. And when you flip a bottle around to read what's in wine, what does it tell you, Chelsie? Can you elaborate on what you would learn from flipping a bottle of wine around to learn what's inside what you're drinking?
You know what? I'm not sure. I don't know where you're going with it.
There's absolutely nothing on the back of a wine bottle that tells you what's in it. That was my point. So when you flip over a food label,
Right answer.
when you flip a food label,
Yeah.
it tells you what's in it. That actually came out when I was in medical school, labeling food with what is in it. And then if you read the dirty little part at the bottom, they'll say artificial flavors, natural flavors, sulfites, nitrate, well, all the stuff. So I bring this up because we have a lot of patients who are super sensitive to drinking alcohol. And our livers are the main things that detoxify. One of the main things that Chelsie has to do is get your liver working better. So Chelsie, why do my poor patients, basically, they can't drink anymore? When you have a really revved up immune response or chronic inflammation, or we'll get into breast implant illness, why on earth can they not drink?
We love our wine. We want to relax. And I tell our patients, I'm like, you gotta like decrease stress in the body in every way possible, just to rest your nervous system so that your body can heal. We have to be in a state of rest if we want to heal. And I think that so many of our patients they're just having that glass of wine every night, sometimes 3. And what happens is they come back and they're doing so amazing on detox. And then they come back and they're like in phase 3 of our program, a few months down the road. And all of a sudden they hit a slump. And I'm like, okay, let's talk about it. What's happening? What are you doing? And so many of them are like, well, I was doing really well, so I started drinking wine again, but I'm having a glass a night, 2 glasses, 3 glasses a night, those types of things. So it's really setting them back for a few different reasons. One, it's just so impactful on the liver. So the liver has to process alcohol, it has to process the toxins, and there's just a lot of burden on it. And this goes back to that detox retox conversation. So my example that I really give is, if I am dumping dirt on your floor while you're trying to vacuum, we're not going to get very far, right? So you're creating a chaotic situation where you're putting things on the carpet that I'm trying to clean off of the carpet. And that's really what's going on the inside. Alcohol also causes more of a microbial imbalance. So dysbiosis, if you will, that's really where kind of like the bad guys, as we call them, are more overgrown. It causes fermentation of the gut. It causes yeast overgrowth, all these things. So our patients are really just fighting that when we're trying to kill off pathogens and really take control of the terrain in the gut, and you're adding alcohol to the situation, you really lose control of the situation. So when they stop alcohol, they usually do better. And our colleague, he looks amazing now that I've convinced him to get off of alcohol, because I walked in the office one day and I was like, oh my gosh, you look amazing. No inflammation in your face, you're losing weight, and all because he got rid of the alcohol and actually followed the detox protocol as it was designed.
The thing I was going to say is, and we can obviously go a lot of different ways with this, but if we're looking at our patients, let's say our explant patients, and they're 6, 9, 12 months out from surgery based on their logistics and what they need from detox, and we can go into that a little bit later. They'll tell us stories how, they've progressively gotten more sensitive to drinking wine. And for everybody listening, there's something called OkroToxin, which is a microtoxin from fungus, particularly Aspergillus black mold, and it's put in wine. And in the European Union, there are very strict rules with how much of this can be put in wine, and it limits, because it's a toxin. I mean, it's another biotoxin. So it's in our country, once again, what I said, unless you're drinking organic or dry farm wine, you're definitely going to get a load. And I'm just going to use OkroToxin as an example of OkroToxin. Now, how much we don't know, and how sensitive you are, we don't know, but we can do some testing to help better characterize that. And maybe I'll start there. So, after 7 years of looking at tests, and we've discussed this internally, we look at functional genomic testing through Envision Labs, is the current vendor, looking at drug metabolism, methylation pathways, how glutathione's metabolized in particular, and we'll touch on that, and then how, obviously hormone metabolism, mood, carbohydrates, protein metabolism, all the things that will ultimately basically give you, depending on your environment and how you're doing things, a phenotypic expression. So your genes are what you're encoded with, and your phenotype is how they're being expressed, and things can go off and on based on your environment, obviously, and stress levels and hormones, etc. So I always hear this story for the people who have bad mold exposure or just don't detoxify well in general through the glutathione pathway in their liver. Yet, Chelsie, all of their blood work is always normal, correct?
Absolutely normal.
Okay, so when I was in med school, they'd say the functional aspects of the liver are like protein synthesis or protein production. And we always just say, like, that's it. You know how screwed up you have to be to have impaired protein function in the liver?
Absolutely. So we get these tests back and they're normal. And that is one thing that our patients say, I don't understand why I have to detox because my liver is normal on blood work. And it usually is. But by the time you reach abnormal liver blood work, you are very, very sick. You're like way beyond, and I'm not saying we don't have sick patients.
You're going to be on a transplant list. Like, you people don't understand, like, when your blood work is bad in your liver, you're sick as shit. That's not normal. When you got to really elevated bilirubin, or really elevated alk phos, maybe had a gallbladder check, whatever, some stuff like that. But if your AST or ALT are super elevated, you're cooked. Like, it's bad.
Yeah.
So, I mean, it's not a joke. But when people tell me that, I'm like, y'all don't realize the same tests you're talking about were created before I went to med school, and they'll still be using after I'm dust. Because that's basically what's going on currently in the medical environment. It's not the standard of care and the best practice. This jargon's used all the time, but the place where we go now is functional genomics and looking at toxicity testing. And we're going to have more things with metabolomics and specific end products or metabolite testing as we go further along, because we both understand that in our patient population, and I think in general, people dealing with chronic inflammation who are interested in reducing that to prolong life, so a longevity play, of course, they're going to need better, more sophisticated, more specific testing as it relates to liver. Kidney is like totally a different game. Like the kidney, that's a challenging one because it's not such a reparative organ like the liver. Because if you, just like you told our colleague to reduce his grape juice intake, so that liver will help its own cause, really. It'll regenerate. Unless you've scarred it up so bad that it can't, your liver will come back and help you. Kidneys and lungs, not so much. Once that's done,
yeah,
that's done.
And we do, like, we use blood work. Blood work there is a time and place for all of these things. And I think the big thing to see here is that what I love is when our patients grab, our bundle of 5 tests, and we're looking at everything. We currently are using 5 different tests. Now, blood work is a piece of that. Genetics is a piece of that. And then we use some additional functional tests, looking at toxins, mycotoxins, which is the toxin from mold. We look at environmental toxins, which is things that you're taking in from around you in your environment, things like BPA, glyphosate, herbicides, pesticides sprayed on food, parabens in your skincare, phthalates, those types of things. And we also look at food sensitivity testing. So when we have all of that coming together, it can just paint such a beautiful picture about what's going on inside a person's body. And, just the genetic piece is so amazing because it's really looking at those weak links. And so many people get afraid of their genetic test. They're like, oh no, my genetics are horrible. But the great thing about genetics is that they're showing us what is possible if all the pieces are, not going well in our life. It's more about, go ahead.
We're going to go off scripture and say there's a lot of people selling a lot of genetic stuff on the internet.
Yeah.
And somebody in particular who's been on a very big podcast is selling things, 5 SNPs or 5 gene mutations for $600 or something like that. We look at, I think, over 250, and it's about $9.99 something. But so I just wanted to interrupt Chelsie to, for listeners, you have to be very discerning about what you're buying and what you're getting, and then what is the plan for what you're buying and receiving. If there is no plan, then I don't know what you're buying for, because the development of a plan for reducing inflammation is really the game here. And I didn't mean to interrupt Chelsie. It was top of mind that I've seen so many adverts, so many labeled experts about genetics. It's become a comedy of sorts out there. So whether it's, and I'm not going to get sued by anybody, who should I say? Something X and something Y and a couple things here out of I'm not going to say their names. I don't want them all getting pissed at me. It's fine.
Let's keep it clean.
Yeah.
So there's foundational medicine, right? And that's the things that we should all be doing from a foundational level: nutrition, diet, exercise, all those things, sunlight, getting your sleep, drinking your fluids, all those things. That's more like the foundational medicine. And I feel like a piece of what we do is really foundational medicine. We're working on, yes, the detox systems in the body, and we're focused there. But I feel like that is such a foundational piece of medicine. And if you ask me, do you prefer a multivitamin or would you rather someone detox? I'm going to tell you detox all day long, because that's really, to me, that's very foundational. And I think even in my own health journey, it's that's the piece that I missed for so many years. And I was popping all these supplements and multivitamins and minerals and just trying to balance things and a pill for the ill type mentality, the way that I was trained in traditional medicine. And then when I move into this functional space, I realized, oh, there's actually a deeper level. There is the foundations. And then when we move into very specifics for a patient, that's when we start pulling in a lot of these lab tests, and we're looking, how do we add in specific pieces to that to really support someone's DNA? So glutathione pathways, for example, Some people may detox fine. Our general patient population has a very difficult time detoxing. And that's really why I think a lot of these breast implant illness symptoms are showing up for these people, right? They're not able to get rid of the toxins as efficiently. So for our patients, we can support things with things like glutathione to really help with that detoxification, vitamin C to help with antioxidation, methylated B vitamins to make sure that they're methylating properly. If these pieces of the puzzle are not in place, then we don't detox efficiently. You can put iron, you can put, zinc, you can support your immune system. You can take all these single supplements all you want to, but if your body cannot process things efficiently, then you're just really not going to heal.
Yeah, I want to take off on that because I'm going to be 55 here in like whatever, a week or two. And I remember when multivitamins came out. I'm always thinking back in the old days, Madison Avenue created all this advertising and it would come out on TV. It would be in magazines. I know a lot of y'all don't know what a magazine is or TV, but those used to be the proper platforms. That was and radio. But I mean, honestly, I never even listened to radio to get that. You kind of listen to your own music. But TV, and magazines, man, they used to just rule. And now, you think about it, think of the segmentation of the population. And, it's kind of like food, Chelsie. Back in the, I believe it was the Nixon administration. So the point was make as much food to feed as many people as cheaply as possible. And that got us in the predicament that we're in now. Now we're into things where the soil's a disaster and you have to do regenerative farming. And many of our patients, as Chelsea's alluded to, have herbicide and pesticide toxicity from eating foods that were sprayed. And if you don't know what the dirty dozen is, you need to Google the dirty dozen or go to the environmental working group and look at the dirty dozen. And it's everything you eat if you're trying to eat, quote unquote, the clean way. And we have to help a lot of patients understand that even though you're making these strides, because you have to start somewhere, everybody can not drink out of a plastic water bottle like I did, obviously hundreds of thousands, if not millions of times in my life and get phthalates from that. Phthalates, for everybody listening, is something that makes plastic water bottles firmer. It's a plasticizer. And you can definitely get it into your system from drinking out of plastic water bottles. So we shouldn't do that. Eating things that took forever for me to know that I don't metabolize gluten and I shouldn't eat. So many people at this point understand celiac disease, which you should not ever have gluten. And then non-celiac gluten sensitivity, which is what I have, which is I have just incredibly limited ability to metabolize gluten. So I shouldn't eat gluten. Neither should my daughter. So last night was her birthday. She's 16. And we had gluten-free cupcakes to celebrate that. Like once it's just purely a behavior modification, then adjust to purchase your food, prepare your food. And, not obviously, we'll just say, don't cook in seed oils, please. That creates PUFA, and that's not good for you either. It'll make more inflammation. What am I leaving out here? Oh, we talked about water. Drink filtered water. We don't need to go into the fancy RO aspects of things and adding minerals back. Just drink filtered water. And then your air quality, since we are talking about mycotoxins and liver, many people that we take care of get exposed to mold. And if I'm talking to you in an interview and you don't make any sense, or if you call me and you have a lot of anxiety after surgery and you're not making any sense, or just in general, you're just still very symptomatic and Chelsea's working with you to help get your mycotoxin count down, you have to make strides with your air quality really from the start. And we've partnered with a company called Jasper. Jasper's air filters were created by a disaster relief expert, and they reduce and effectively filter air. Plus, they're not ugly, so my clients really like them. They're aesthetically pleasing. Me, I don't care how something looks, but 99% of my clients are female and they want a pretty air filter. So Jasper has a pretty air filter. But I feel like that's just the dirty little thing going on all the time. And people are so, I don't even think it's gaslit. I don't know what you would call it. I think it's underappreciated how problematic mold exposure is. Maybe you could just touch on like what you feel that level of toxicity is. Say it's the 95th percentile on our tox report, and it's one, two, three, four, five of them are mycotoxins. And the head of the list is OkroToxin, followed by aflatoxin, and then fumicins and all the things. Like, what are you going to do? Like, where do you start with those folks?
It really goes back to our conversation on foundations, right? Now, foundations is foundational for all people, but here's where we kind of get into modification for each patient and what they're experiencing and what their lab tests are saying. So a lot of our patients will have mycotoxins that are more related to food, and some of them will be environmental. And really our approach depends on what they're exposed to. So when we're talking about food molds, it's really going to be coming from things like grains for the most part. Think about just mass production of grains. And I just imagine these grains like sitting in a barrel. I don't know how they're produced really, but a lot of those things can grow mold. They are picked, they're alive, they're wet, they're piled into a pile to dry, and they're drying the grains. Just the whole process really is can cause mold to grow. So grains, it can be wheat, rice, corn, barley, oats, all those things are really high contaminated in mold. When we're looking at nuts, mostly things like peanuts, which I know is a legume, peanuts and pistachios are two of the highest. Coffee. So we usually use and tell our patients about low mold coffees. So I know Dr. Whitfield, you love Danger coffee, those types of things. It's really tested for mold. So just making sure that you're drinking a clean coffee. The other thing is fruits, or dried fruits particularly. You can see mold growing on berries sometimes. So just making sure that you're cleaning those things. And just something simple like apple cider vinegar wash can really kill mold growth on your fruits and vegetables. It's something simple you can do in your home using a filtered water, and just something like apple cider vinegar. And then dried fruits are huge, like just eating dried fruits, adding those to yogurt with granola, all those things. A lot of that has mold. And then you go into the environment. And some of our patients have had to completely remediate their homes. We found that they had mold in their homes. We have a patient now who's been on her journey for a little while now, and she's finally able to move forward with, a fat transfer, and some of these other pieces to her puzzle are finally coming together because she was able to clean up mold in her environment. So mold remediation means your walls and like everywhere that you have the mold. Another piece that you may not think about there is your furniture can be a collector of mold. So if you have to remediate your home, I know this sounds like just detrimental to have to replace every little piece of furniture, but like if you're sitting on a chair every day, or if you're sleeping in a bed every day after you've had severe amounts of mold, especially if you live in a humid environment, you don't have air filters, all those things. Here we go with this detox retox conversation, right? So you've detoxed, you've cleaned everything up, but now you can have additional mold exposure. So this is really a piece of the puzzle that, we find for some of our patients. Not everybody's living in mold. Not everything is that severe for people, but there are very simple forms of mold exposure, like I'm getting exposed in my food, versus I have an active leak in my home that I really need to repair because it is impairing my body's ability to heal.
So I have a good story. So shout out to Jean, who's improved a ton, is going to have her fat transfer. And I heard the worst mold story this past week. A lady who traveled between Austin, and I guess it was DFW maybe, so for work. And she said she bought coffee and had in the passenger side seat had several of the trays holding the coffee, big ones, not little ones. Something happened, stopped abruptly, all of that spilt. So basically, week over week, month over month, she would not feel well when she got in the car and made that same trip. Her and her husband tell a story where she kept telling their husband, and he's like, it's not the car. She said, no, every time I drive, I just don't feel well when I get back. So it was a constant, intense exposure for everybody listening. So you get into a closed environment. So every time, imagine you open the car door, spores. You shut the car door. Now it's in the air system. You're just recirculating it, and you're breathing it in and out, in and out, in and out. So they said they took the car in, ripped up the passenger floor, mat, mold all up and down. So I'd never heard that before, but it makes a ton of sense. Spill a bunch of coffee with milk and sugar, and what do you think is going to happen?
Yeah, and I've experienced that same thing in an apartment. That was my mold exposure, and I was hallucinating, and I kept having I was just like, I would feel drunk sometimes, and my husband's like, Chelsie, what is wrong with you? Like I don't understand what is happening to you. This is not normal, and I'm like, I know it's not normal, but I would drink coffee in the morning. And when I would get halfway through my coffee, I would literally feel drunk. And I was like, what is happening? And this is when Dave Asprey was talking about bulletproof coffee. And I was making my little bulletproof coffees. And I thought, is this the MCT? Like, is this doing something to my brain? Like, is this euphoria? Like, what is this? And so one day, I thought, this is mold. And I don't know what made me think of it, but I had a sauna. I was doing colon hydrotherapy. I was doing all the right things, eating the right diet. And so I went on a little trip over the weekend, and I set two glasses of water in my living room. And I was in an apartment at the time, and I came home and they were covered in mold spores on the top. And I thought, I've never seen anything like this in my life. So I pulled apart my coffee pot, and the filter was covered in mold. So I start looking around. I'm like, and I look at I had a little sunroom, and there was a window, and I looked underneath it, and you could see a gray color on the walls. So I called, of course, downstairs, and I'm like, hey, I think I might have a mold problem. And they come and started pulling that wall out. It was in my shower, in my bathroom. It was under the windowsill. Somebody had a leak in the floor above us, and it started draining down. And that was what started it in the bathroom. And then I guess there was a leak in the sunroom, and I was living in mold. So
the water leak is a huge, huge problem. So I've heard this over and over again from folks in multi-units environment, because something above or next, whatever, something leaks, and then it happens. In our office in Austin, I get a call. I'm out of town for one of the few times ever, and it's the 4th of July. I get a call from the building. Yeah, your suite may be flooded. Somebody, their coffee, they had a fancy coffee maker with water or whatever. Something broke, it leaked. And so our suite ultimately actually was fine. But the suite across from us and the suite behind us flooded from a coffee maker. So you're just seriously, you're like, okay. So whether it's your condo, apartment, built, whatever, your home, I've heard this happen on poorly sealed roofs, poorly constructed homes. And what Chelsea's describing, and I guess we can dive into why that's so problematic. What Chelsea's describing is she got acute neural inflammation that made her hallucinate. Some people get panic attacks, super anxious, and then it goes to, all sorts of other things, gut dysfunction. You can have migratory joint pain, psoriasis. I mean, you just, whatever. You can name, all sorts of things. Once that is just gone off and it's reached your ability to detoxify, which she mentioned is, going to be, everybody has a genetic baseline where this is how much you can detox. And then depending on the air, the food, the fluid, the environment situation, the stress, we can talk about stress, that's going to, if we use the bucket analogy, once your bucket is full, bucket runneth over, and then you got problems. So, she's describing a very common thing we run into, but a very important thing in terms of conceptually understanding why you can get super symptomatic. And, I tell everybody that for a breast implant illness, I get asked all the time, is there a specific test I do? Is there one thing I know? What I know is when I listen to somebody, I already understand a lot about how they detoxified by just their interview with us. And then they'll basically tell you, if you listen to them long enough, where the exposure was. Chelsie just told you where hers was. But, many times we just have to ask folks and they'll relate something. A lot of times it is mold. My most complicated people are those with mold and Lyme.
Lyme's tough.
Lyme I interviewed someone about Lyme recently. It'll be on the show. Oh, that's a teaser. We'll go off script. That's a teaser. I'm going to have a show about mold with a mold expert, Diane Mueller. Yeah, don't know when. It's coming up. And I did that with her because, you know, as you know, in our practice, we don't and haven't made an emphasis of doing anything for Lyme because obviously we're already, in terms of testing and detoxification and surgical recovery. It's not that we're at our limits, but we have a lot in place already. And we certainly want people to get the best care. And if we don't feel like we can provide that, then we're not going to, you know, create an offering for something we can't, you know, successfully help you with. So the kind of symptomology that we get and the detoxification that Chelsie then runs, it's certainly not like a short process. So I tell everybody, if you have or feel you have breast implant illness, I look at it as you have a chronic inflammation and the breast implant is part of it. So if we take the breast implant out, definitely will help you. But detoxification without retoxification or detoxification without a plan to avoid retoxification, God, we could make a whole song about that. You're going to still struggle. And that's why people who I took care of for years before we started really, and it was all because of the pandemic. Like the pandemic sucked. My dad passed away, thousands, million, you know, hundreds of thousands of people, millions of people lost their lives. You had to reorganize and restructure. And it basically forced us to start doing all of our own testing, all of our own evaluations internally. And then, you know, now we actually have a team in place that's led by Chelsie for detoxification that really helps take care of our patients. And that all was born out of that. We just had to stop. We couldn't send anybody anywhere. Nobody would see anybody. So it just became our job. And that led to, you know, the next, not innovation, but we just kept trying and establishing benchmarks for tests. And, you know, we're always looking and trying to benchmark the next best, you know, test for us to help our patients. So long story short is that's the sharp, you know, process really is born out of taking care of our own patients and using best available functional medicine testing, genetic testing, toxicity testing to help them, you know, set a benchmark, and then working with Chelsie and our team to detoxification through the detoxification process without retoxing all the time. So, oh, we should bring up saunas. I always get in trouble for saunas. But we have a good second hit on barrel saunas. So, and I didn't know this, but I'll bring it up. One of my great clients from Austria, she's like, I was doing sauna all the time. And I'm like, oh, okay. And I couldn't remember her specific tox test because I have thousands of tests. And I pulled it up. And sure enough, she had a lot of heavy metals in it. So Lauren Bostic, the Skinny Confidential podcast host, she had the most heavy metals of anybody I've ever taken care of. And she had a barrel sauna at her home and she would just cook herself repeatedly. And between her and her husband, he'd be like, yeah, man, she's very intense in the sauna. And I'm like, okay. So I can tolerate about a half hour, an hour sauna at 170, and then I get like, I'm over it. I'm under the impression, according to her husband and herself, that Lauren would do at least an hour at 212. So for everybody listening, an implant, oh, I'll tell you what I told you before. I talked to Lauren about not melting her implant. What she was actually doing was leaching from her implant into her body, and that gave us the toxicity report. So a lot of people on the internet, a lot of plastic surgeons, a lot of societies, probably some other organizations don't like me, took pot shots at me because I said, oh, we were not melting your implants, Lauren, but you're leaching all of the chemicals and heavy metals out of them. And so there's standards set, you know, about how much a body can tolerate. I always find those standards interesting, how they arrived at those. But I can tell you she has pages, not a few, not 4 or 5 in the 95th. She has pages in the 95th percentile on her tox test. Now, I took her implants out and she did have the, ooh, I feel great in recovery. Just selfies with me and stuff. I'm like, okay, we'll see how you're doing tomorrow. Day over day, week over week, man. That was like, you know, you just put rocket fuel in her and she was already pretty jazzed up. But I mean, after that, you could not hold Lauren back at all. I didn't see her for like 4 or 5 months. She went and spent the summer in Italy on Lake Como, got her tox test back, no toxins. Of course, she didn't do any detox. We didn't even have a program back then for that. And I'm sure she was retoxing the death out of herself with good wine in Italy. So I don't think, you know, for a minute that she did anything, just live life. And of course, probably could have done the tox test a week after surgery and shown that it was gone. I took everything out, it was totally intact, like a perfect situation, like all things align. It was just one of those things where I'm like, I do a lot of, obviously, I've done surgery for a long time. But that one in general, when you line up like what somebody was symptomatically affected by, combined with a surgery technique and retesting to show not along with all the physical symptoms being gone, that is everybody's public service announcement. Should you sauna or not should you sauna? Oh, let me say it differently. Sauna or how did I say that? To sauna or not sauna? I don't know. I made some post about the other. But the point is with implants, nobody has any information about sauna. So whether I piss off all the IR sauna companies or the Finn sauna, I don't care. Doesn't matter to me at all. Just don't care.
Yeah.
If your implant is degrading over time, which it is, trust me, it is. If you cook it enough or cook yourself enough, you'll definitely cause leaching. That's not the earth is flat concept, right? It's going to happen. I wouldn't pay for a study to be done in a place where like Finland, because I don't know how many implants they have. But in our place, I would love to have all the barrel sauna people line up, show out, give us your urine. Never said that on air before. Give us your urine and see what it shows. Why not?
I did sauna I bought a sauna in 2009. It was a graduation gift to myself and had heavy metal toxicity and used that as a part of my journey. I had implants at the time and they were fresh. They were probably newer implants. I was pretty young. And I would say my implants may have been 5 years old at the time, when I started sauning. And over time, I think I'm just so grateful that I've been a detox junkie for a long time, using the right formulas, using the right food, using the right, detox tools. And later on in my implant illness journey, I realized that when I would get in the sauna and get out, I almost felt like my brain fog was a little better, just like it cleared, but I always had a rash. And I would get a rash on my breast and I would get a rash on my belly. And then sometimes I would get one on my back and it was almost like a viral rash, it was like, but I was like, oh, I'm just getting rid of toxins. Like that was my idea. Like my skin is a big detox organ and I'm just pouring, getting rid of the toxins through my skin. But the thing about a sauna is that its job really, an infrared sauna's job is to heat your body at the core, right? So that's the goal of that. That's the technology that we're utilizing from a sauna. So it's not like I'm just externally sweating because I'm working out, or I'm in the sunshine. No, I am like heating my body at the core. So yes, we're heating our implants, and it just makes sense that they're full of all of these toxins. They're full of heavy metals, and those things are leaching, into our system. And I like to say the same blood goes everywhere. So those toxins are traveling all throughout the blood that can impact every single organ system in your body, from your brain to your belly to your toes. It doesn't matter. Yeah.
It is quite the paradox, right? So people want to be super healthy. We know a ton of them, right? And I think women in general, I have a great deal of just admiration for how hard they work in general, but then how aggressive they are with everything else. Like women definitely they go like and push the chips all in. Like Lauren, like there's no half-assing when you talk to her about anything. Like she is all in all the time. So if you told her like, hey, go use the sauna, hour a day, 7 days a week, 3 months straight, you're gonna feel better. She's gonna do that. And the minimum is gonna be the hour. God, she might do an hour and a half every time. Who knows what she would do? And if you told the same to somebody about an IR sauna, same thing. And then you may get a Herxheimer reaction, which is, basically you're detoxing more than you can control. And then you get more symptomatic and they're like, whoa, I don't feel very good. I feel like super tired. I'm, like you said, you may be hallucinating when you get out. You're just like, okay, well, that was an intense sauna session. Like, no. That was a little bit different. Like you're leaching chemicals into your system to make yourself unwell. So I think obviously like take homes, honestly, for our patients who want to undergo detoxification, whether or not you're having surgery with me or Dr. Chung in our practice or anybody we bring on, you can still run a detox program because Chelsea's our lead, and we're building out the program under her to help take care of more patients because we know it's super valuable. So that's one thing. So the SHARP process and detoxification with us can be expanded to folks who live outside, which most of our patients live outside of Austin, but the patients who can't come to Austin for surgery. So that's one thing, obviously. And then if you want to learn more, you definitely have to follow us on Instagram and learn more from Chelsie. And then, for the folks who are experiencing breast implant illness, I definitely want you to become educated through the podcast, through our YouTube channel, through our social channels on Instagram and LinkedIn and X, formerly Twitter, or whatever we're calling that. And you have to dig in and become a student, if you will, of the game, because it's a very important decision to come and have an explant as Chelsea's had. And then we only want the best for you afterwards. We're always trying to improve the programs as much as we can, as quickly as we can. When we have you in Austin, we'll take great care of you. We'll send you to the well so you can have some gluten-free, dairy-free, seed oil-free food. You'll come to the office and get some hyperbaric lymphatic massage with Lopresso, red light therapy, stem cell therapy, peptide therapy, whatever we got that, the FDA doesn't, crap on that week, we'll try to offer. And we look forward to having you and taking care of you the best ways we can. I want to thank Chelsie for appearing on the show today. Any last words, Chelsea?
Thank you so much. It's been a pleasure to be here. And I'll just say that our goal is really to plant those seeds for the foundations for you and to really get you in the healthiest state that we possibly can after explant. Like truly, that's the heart of our team here. And just to see you walk away healthier than you were before you even got your implants, hopefully. So we look forward to working with you and taking you along the journey.
All right. Thanks, Chelsie.
Thanks so much.